Good afternoon, everyone, and welcome to our conversations with G&G, Caring for the Carer. I'm super excited to run our fourth session for a fantastic show that we are very, very proud of. And today's topic is signs your aging loved one needs help. So I'm super excited to go deeper into this topic that is very close to our heart, and privileged to have fantastic speakers here today, which Danny will introduce you shortly. I'll pass it on to you, Danny.
Yes, well, today we have the pleasure of introducing our wonderful guest, Lisa Ross. She's not only a dedicated medical student at Deakin University in Geelong, but she also brings with her 16 years of invaluable experience as a physiotherapist. Her passion for patient-centred care shines through her work, particularly in her special interest in supporting individuals as they navigate changes to their physical health and well-being with age. Lisa aspires to become a general practitioner with a focus on geriatric medicine, demonstrating her commitment to serving the ageing population with compassion and expertise. And beyond her professional endeavours, Lisa wears another significant hat as a devoted mother to 3 daughters. In her downtime, you'll often find her tending her garden or relishing in the joy of shared meals with her friends. Please welcome Lisa Ross.
Thanks for having me. I'm really privileged to be here today to have this conversation, something that I really care about, and I'm happy to share anything that I can to your carers and see what we can do to help.
It's great to have you. It's a big topic, isn't it?
It's a huge topic and something that everyone seems to navigate differently, and there's so many challenges around how to bring it up respectfully with your ageing loved one, but also helping them to live the best life they can as they age.
Absolutely. So much value into this today's topic. I went through all of that myself. Being a professional in the industry for the last almost 10 years, I went through myself with my own family members, and I tell you, it's not an easy one.
Yeah, it's something that a lot of people struggle with, like how to bring this up or how to navigate it respectfully. So I think it's a great conversation to have today.
Excited.
So
Very
what
good.
would be some of those key things that differentiate between normal ageing and then perhaps signs that a loved one would need some assistance?
Yeah, that can be really tricky. It looks different for everyone, right? So I think sometimes we have this idea that normal ageing includes becoming more frail or feeling less confident, going out less. And I think it's really important to think about that as not normal ageing, and that people can live a really fulfilled life as they age, and being able to do the things that mean a lot to them. Danny, you might have more to say around it's important not only the physical health as you age, but also people's mental health. So a lot of clients present with symptoms that could also be depression or mental health related as well as physical related, and it's really important to get that into play and navigate that really well as well.
Yeah, I think that's completely accurate. And the big thing with mental stuff too at that age is everything that's happening, you know, you're on that downhill run, so to speak, you know, where there are so many positive things, like you start to not care about a lot of things in life, as in, you know, you've been there, done that. You don't worry about the things you used to when you were younger. You've got grandkids and all those wonderful things, but you've also got that, I guess, the losses and the changes and the grief to deal with in that moment too. You know, you might have more friends that seem to be passing away because you're getting a bit older. And then you've got that sense of identity when you finish work. Maybe you've had the same career for a long time. Your sense of self-worth and, you know, what do I do now? Who do I connect with if you lose a partner? So there's all of those kinds of challenges, as well as dealing with the everyday, you know, I guess, struggles of life in general. And so I think when you get to the physicality of that and the mental thing, it's really something that needs to be dealt with hand in hand. And Lisa, you would see that a lot in your work. It's never one or the other, is it?
Yeah, it's definitely a really complicated interplay. And I guess when we talk about normal aging, it's normal to lose muscle mass and to become less strong.
Yeah.
It's not normal to not feel safe walking or to be worried about falling over.
Or having the fear
Having
that
the
something's going to
fear.
happen. Yep.
And I think it's really important to think about maintaining functional independence. You know, it's a big thing that people want to maintain their independence, and they'll grasp onto that, and that might mean that they figure that using a walking aid is that this is me not being independent anymore. And the conversations I try to have with patients and clients is that giving you something to make you more safe will actually increase your independence, because you can do more, you can walk further, you know you have a seat, so you're not afraid of getting tired. And that if you were to fall and fracture a bone, that is really something that will actually end up as you being less independent. So I try to have those conversations really respectfully with patients.
Yeah.
I know that, you know, you're not feeling so well or you're unwell at the moment, and a lot of the time it's people that have been in hospital.
Yeah, because we know that, like, when one of those events, like a fall happens,
Yes.
patients' clients can usually decline quite quickly after
Absolutely.
that. So it's important to be proactive and have those conversations to prevent those types of events from happening.
Yeah. And I think too, acknowledging that it's normal to be fearful after you have had a fall.
Yeah.
It's quite frightening.
Yes.
They might have been alone or on the floor and not able to call for help. So acknowledging that fear is normal, but the unhelpful aspects of it we sort of, I guess, need to broach or challenge, and that you don't want to get into this cycle where we are fearful of falling, so we move less.
Yeah.
Therefore, we become more weak, and then we're at more risk of falling. So it's trying to tap into that cycle and break it through building confidence, whether that be through some exercises that you can do at home safely, or joining into a group that increases your physical activity and strength.
Yeah.
That's very well put together. It's, great piece of advice there. Yeah, and how do you get it to break that pattern and that pattern out of fear? You know, building on the positive maybe. What are some of the strategies we could all use, and even interesting to hear from you, Danny, there.
Yeah, I think fear's an interesting thing, because sometimes what happens is we get into what's called a fear loop.
Yeah.
So we'll have a particular situation that's happened, so it might be like a fall, for example, and weren't able to call for help, and of course, you know, when something happens to us that we feel fear over, we begin to worry that it will happen again. And sometimes we get caught up in the what ifs. What if I fall? What if no one can come and help me? What if I die? What if I, you know, all of those kinds of things. And then we develop that fear of the fear. And when we have those, obviously, mental thoughts of fear, that often develops into physical sensations. So when we start to feel anxious, we might feel short of breath. We might have palpitations, we might break out in a sweat or feel dizzy.
You manifest what you fear about
Yes.
in physical, actualities.
Exactly.
Yeah.
With all those thoughts going on at the same time. And then what can happen if that continues and we develop into an anxiety disorder, not only will we have the panic attacks, but we could have the loop happen in the reverse. So it might not be necessarily the thought in itself that we feel like's triggering it, but we might be doing something and all of a sudden our heart starts to race, or we feel a bit breathless, and that triggers that physical symptom that we felt while we were panicking. Then the thoughts jump in on that level. Oh, I'm starting to panic. I don't want to feel that sensation of panic. And then the different thoughts come in about that. And then we end up having different situations where the fear comes in. So what happens is, you know, if you imagine the world as like a box, and we can do anything within that box. The world's our oyster. It's amazing. And then this one particular day, you know, we have this fall and we have a panic attack, and the fall happens, say, at the supermarket. So all of a sudden, what do? We stop going to the supermarket. So our world, our box gets that little bit smaller.
Yeah.
Then we have a panic attack the next time in an elevator. So then we stop going into elevators. And if that pattern continues, we actually end up potentially agoraphobic, where we won't even leave the house. And we see that a lot with ageing people. They start to lose confidence in social situations, whether it's a fall or just the anxiety of being around people or whatever that is, maybe pushing the shopping trolley. So it's really important to, you know, speak to a counsellor or your healthcare professional about that confidence-wise too. But I think, Lisa, you made an important point, you know, about that interplay, but also the prevention. And I think that's super important, especially from a mental perspective, but also physically. And so what a lot of people probably don't realise is that Lisa, as a physiotherapist, can actually assess people as, you know, their maybe loved ones or themselves are noticing a bit of weakness. So, Lisa, do you want to talk to that a little bit? Because if we can get people more in that mentality of
absolutely.
getting a physical checkup or noticing, hey, mum's shuffling a bit or her gait's a bit off, or those falls could be actually prevented, which keeps them independent at home longer.
There's a few things I think that are important and that people can do. Firstly, that physiotherapists, they're a primary care provider, so you don't need a referral from your GP to go to a physiotherapist. So that is something that families can initiate themselves. And you can also get a care plan from your GP in where you get 5 subsidised visits, whether that be podiatry or counselling or physio. If you have a chronic disease, so say if you have osteoarthritis, diabetes, cardiac issues, you could ask that physiotherapy be one of those 5. You can choose how they are split up. And I think that would be a great way for patients to, or clients, we use 2 different words when depending on the situation we're in, to have that screening, have some ideas around what we can do, and remembering that our physical function can always be improved. Just because you're aging doesn't mean that exercise will not make a difference. So I think being more proactive about how we think about our physical health as we age. And they're really simple things. You can have exercises that you do while you're putting the kettle on, for example. You can strengthen your legs. It's 5 minutes. We can do that a couple of times a day. Could be going for short walks and multiple short walks rather than one big long walk, and then building up. So I think if we can think about it as a prevention, that's a great way. The other thing is that if someone does have a fall or is feeling anxious, we can think about things that we can do to increase their confidence. You can have a conversation about having a call bell if something, a falls alarm. I can't remember what they're called.
Yes, false alarms,
And there's lots of different ones out there on the market now,
absolutely.
whereas it used to be this one with a chain and people were embarrassed and they would take them off.
You can even wear it as a watch.
You can have a smartwatches now.
Yeah, and automatically calls. So you don't even need to do anything really. It just triggers all of that automatically.
Yeah.
Even Apple Watches now have
You can
like
call
fall
on them.
detection and
It's
hazard
so much
detections
better.
and stuff.
What we do find though is in the hospital, people will fall in the bathroom and we'll ask them, where was your bell? And they will have taken it off.
Yeah.
They are made to wear in the shower. So it's one thing that we do try to encourage people.
Yeah.
Actually, that's the place where it's more risky.
It's more
if anything.
risky.
More risky, yeah.
And a lot of the falls do happen in the home. And there's things that we can do. We can remove rugs, for example, tripping hazards. Some of my clients will say, I'm not old enough for that, or they feel quite reluctant about having something that would call for help. But I've found that if families can say, Mum, I was really anxious, or it would be helpful for me to know if you've fallen, it would be reassuring for me, that's one way that families can broach that subject around knowing that they can be called if something goes wrong, because it's, people don't like asking for help. But if the family can say that they would like to be able to help or know if something's happened, that can be a useful way to broach that.
Yeah, it's a good point. And also understanding that those pieces of technology or devices are not very intrusive.
Yeah.
As you mentioned before, it's just like a smart watch, really, or there are different types of device that could fit preferences. Or
Yeah, absolutely. And I'm finding the older generation are fabulous at using devices now, especially
They're
after
embracing
COVID.
it, aren't they? It's great.
Nearly everyone in the hospital has an iPad or a smartphone, and they'll be calling their friends. So it is something that lots of people are using now.
And especially the technology with something as simple as an Apple Watch.
Yes.
Heart rate, oxygen, all of those things, even falls detection, I think you can.
There
get
are
them
some with
even
falls
on-
detection that will notice if you've changed height rapidly.
Yeah, that's right. So it's all that multi-use stuff, and even taking calls and things like that. So I think we'll only see more and more of that, but being familiar with it and having families being willing to, I guess, engage in that and look into it's another thing, isn't it? And I think that's the important thing to remember too. I know when we were looking after my granddad, he was just adamant that he didn't want to go into aged care, and he'd had a couple of falls, and this particular day had a fall. He couldn't get himself up, and thank goodness we were there. And we were like, I think we need to call the ambulance because we can't get him up, and he hit his head, so we're like, he needs to get checked out. We shouldn't move him. And boy, he was so cross with me for calling the ambulance, but it was what needed to happen.
Yeah.
And as a result of that, he actually had some physio in the home. And so they actually came to him, put some weights on his legs. He had his little pedal master on the floor.
Yeah.
And he could, build up his strength. And he ended up being able to get himself back up and out of the chair. And so that's the other option, isn't it? Some services will actually come to the home.
Absolutely. Yeah. And it's a great place to do physiotherapy and in the comfort of your own home, but also you can work on functional things that are important to the patients. And like you said, being able to get out of a chair is one of the hardest things to do. It uses all your big muscles.
Yeah.
It's also a really good indicator for how someone is going to function independently at home. And it's a measure that physios use, is to measure for how many sit to stands or how long it takes you to do 5 in a row.
Yeah.
And if you can do it with no hands or with hands. But it's a great exercise in itself. We often will set patients up to do sit to stands as an exercise. And you can start from a higher chair and move to a lower chair as you build up the strength. But it does translate to being independent at home, being safer at home. So you can see that little interplay there. And physio can, do exercises at home. They can do it in the clinic. You can do it as a group by yourselves. So it's, it is something. And there's also exercise physiologists that work closely with physios. So that's also another option.
And I'm guessing once the client, the patient, sees a professional like yourself, and they have an exercise plan, and they know there's a plan in place, and they can put all this into practice, and they can see the benefits. It's also breaking those limiting beliefs that oh my God, I'm not going to improve here, or I'm never going to get any better. But as you said before, we can always improve.
Yes.
So even having that, enforcing a positive belief that you can always get better, and just do it a little bit, every day.
And it's self-motivating, right?
Yeah.
You see that you're getting better, so you do more.
Yeah.
And then you get better again. And it's that feedback loop.
I guess one of the tricky things, though, is having that initial conversation with someone that could be perhaps a little bit resistant to even getting some of these things going or seeing a physio. And what are some tips for carers to make this happen,
or family
start
members,
having the conversation with their loved one about this topic?
Yeah, that's a tricky one.
Sometimes it's the tact that we take.
Yeah.
Like sometimes there can be so much stress, like on the person caring.
Yep.
Often you've got people that are still raising their own children or grandchildren, and they've got still working, they've got a lot on their plate.
Yeah.
And so that can be a factor. And then for the client being concerned about, leaving the family home, going into aged care, they sometimes will try and hide what they're struggling with.
Yeah, absolutely.
But when we take it, that tact of, hey, we love the fact that you can be at home, and, we want you to be as independent as you can. So let's put some things in place that can enable you to do that. Whether that be, having an exercise physiologist or the physiotherapist come and, get your strength up so that you can stay at home instead of continuing to decline in that way. And also, using aged care packages and knowing what those services are to put things in place like a rail, or having the opportunity to maybe even have some funding to remodel some things, like if you have to remove a bath to put a shower in, or a bath with a door which you can get, just all those kinds of things that help maintain that independence. And framing it in a positive light.
Yeah. So Danny, you mentioned all those extra things that you can put in place, and I like to sort of bring it up with my clients, or in the hospital system often they've had a acute trauma, so it's kind of easier to say things are difficult at the moment because you've been unwell, and but things that families can think about is asking your loved one, what do you love doing, or what are you having trouble with doing, or if you could do something more, what would you do?
Yeah.
What could you do more of, and what could you do less of?
Yeah.
So
And sort
looking
of
at their
having that-
goals, and
Absolutely.
what they want to achieve,
Yeah,
and then
and-
linking it to that, so it
Yes.
makes it more
more personal, and that they have autonomy over
Yes.
that conversation. And then what can we do? How can we shift the balance so that you can do more of what you want to do? Because often, like, clients are fatigued or weak, exhausted. They might find that cooking is something that is just not bringing them joy anymore.
Yeah.
But if they didn't have to cook, that maybe they would go to the cafe with their friends that they used to do once a week. You know, sort of weighing up those things and then bringing that into play. So what could we do? What services can we add so that we can take the pressure off family members? So you could say, Mum, you know, I'd love to spend time with you. I'd like to take you shopping or go for a coffee once a week. But when I come, I sort of need to do the cleaning. So how about we get someone to do the cleaning so that we can do something that's more fulfilling for us or meaningful, or go to the park with the grandchild.
Yes.
I don't know. There's lots of different ways to have these conversations.
Yes.
So leveraging on the positive, leveraging on what are
Absolutely.
your aspirations, what you would like to continue doing, and things like that.
Yeah.
And I think that's really
Yeah.
true
Yeah.
for
Yeah.
well-being as far as hobbies and joys and interests. So things like, you know, the typical one would be something like gardening. You know,
Yes.
they can't get down up and down on their knees anymore, but we can get some raised
We can
garden
do
beds
raised
and they
garden
can still
beds.
do,
Yeah.
you know, veggies or herbs or flowers, and, you know, bring
Yes.
that joy back in, getting them outside so they're getting that little bit of vitamin D.
And they're making decisions
They're
on what's
making
going in the
decisions.
garden, and so they're feeling that empowerment.
and harvesting
So-
it and sharing it perhaps, and, you know, whatever that looks like.
Yeah.
Trying some new things. All of those things are super important, giving them, you know, that hope.
Absolutely. I'm interested, Lisa, to hear
Yes.
from you another topic, because I went through that myself, that personal experience, you know, organizing services and aids for my parents, right? And
Yeah.
the biggest hurdle I had to overcome was removing the stigma around
Absolutely.
all those aids, and, you know, the four-wheel walker for my mom,
Yes.
or the chairlift that goes up the stairs so they could sleep back in their own bedrooms instead of sleeping on the couch.
Yeah.
Right? Looking at all these things, oh my God, it looks so clinical.
They do,
I don't
yes.
like them. I'd rather sleep on the couch.
Yes.
I had to go through all of that myself, and it was very, very challenging, you know,
Yeah.
particularly for my own parents, right? How do you remain respectful, but, you know, trying to show them the most logical next steps for them?
Yep. That's something that a lot of clients do struggle with. And with walking frames, I find really quite something that people are quite reluctant to use. It. They say, older people use this.
Correct.
Yes.
This is something that old people
The perception
use. Yes.
of who uses it.
And then they'll often tell me that they're 88. Like, and then, you know, they're not in this older group, and it's something that they see as othering to themselves. I try to talk about, like we said, prevention, and that walking with a frame means that they can walk more and be stronger. That it's something that is a visual for others to be careful around them as well, that they might be frail. This stigma's interesting, isn't it? And I think talking to them about what they would say to their friend if they were struggling with something, you know, would they say, oh, you know, maybe you can try this or that? I think the best thing is having a professional have that conversation. It's kind of easier for it to not come from a family member sometimes.
Very true.
They can listen to.
They can, you know, it's...
Or choosing the family member that they're close to, that they will listen to,
Yes.
Yeah.
because there's often that dynamic too.
Yes.
And again, showing them that if you use this, you're going to be independent doing it, whether that be a shower chair. If you could sit in the shower...
Sounds good to me.
You might, I know. Who doesn't want to sit in the shower? But you can do that yourself then. You don't need someone to come in and invade that personal space for you. But it means you're safe.
Yes.
And you can... So I think having the conversations around what do you want to do for yourself and how can we maintain that independence by adding something in rather than taking away the independence.
No, great tips. Get a professional to, I
to
step
so.
in. And by the way, after I put in place all of that for my parents, they absolutely love it.
That's it.
My mom is so happy. My father is so happy. it made a huge difference.
Yeah. And I think using other people also means then that you can maintain that relationship as a loving carer, family member, friend. And it can keep some of those boundaries so that you can, I don't know, stay supportive and...
Absolutely.